Bismillahirrahmanirrahim. So, resuming the same paper, and we have started the paper from the end. So, I'm discussing the SK Gynae bank, but this is not only for Gynae people because the MCQ bank that is essentially the same for all. There's only the shuffling of the MCQs, and we are doing the smart study. So, 66. The median umbilical ligament, the median, it is formed by urachus. The medial with the L, that is formed by umbilical arteries. That is the remnant of umbilical arteries. The lateral umbilical ligament contain what? Inferior epigastric arteries and vein. Inferior epigastric artery and vein. So the 3 MCQ with this thing. Coming next, AST and ALT require B6. That is the right answer. So there are few mistakes if we are studying the book from this end, from the inside. And if you are studying from the inside, you are getting more knowledge, and as there is a fact that more MCQs come from this side, from the recent paper. So I would suggest and I would recommend to study this book from the inside. A person of 33 years old came with a complaints of abdominal pain. After complete evaluation, PCR came positive. He was diagnosed as hepatitis C. Patient otherwise normal. Now, if there is an option of sofosbuvir plus vilpatasvir, this is the right answer because it covers all the 6 genomes of hepatitis C. This is called pan genotypic regime. If that is not in the answer, in the option, what is the best next step? What you have to choose out of the given? The answer is ribavirin and sofosbuvir. This thing. Why not interferon? Well, interferon is preserved, point number 1, in the treatment failure cases. Number 2, in resistant cases. And number 3, those who have taken already hepatitis C treatment. Well, these are the guidelines. So over here they are saying that he is now diagnosed as hepatitis C for the first time and he has not taken in the past. So the option is B over here. Coming next, during oophorectomy, surgeon has to look for its lymphatic and its drain into the para-aortic. So the ovary and the testes, think about T10 dermatome for the pain, T10 sympathetic, and think about para-aortic lymph nodes drainage, para-aortic lymph nodes for the drainage. So coming next, surgeon is performing surgery of adrenal gland, IVC. There's another scenario. A person was performing surgery on adrenal gland. A patient died of shock. The structure that is damaged is IVC. Treatment of gonorrhea and trichomonas vaginalis. Now the answer for this is ufloxacin. This is actually chlamydia trachomatis. This is really chlamydia, gonorrhea and chlamydia. Well, if look for the ceftriaxone plus azithro, this is the current regime. If that is not in the option, then you look for what? You look for the ceftriaxone plus doxycycline. If that is not in the option, the ufloxacin is in the right answer because it kills both gonorrhea and chlamydia. Well, there is another MCQ. A female is having discharge, and on gram stain there are diplococci, gram-negative diplococci. What is the organism responsible for it? Neisseria gonorrhea. What is the treatment? Ceftriaxone. If there is not in the option, then cefixime. Next MCQ. A patient is having pelvic inflammatory disease, or a patient is having pervaginal discharge, and The patient gram stain is negative. What is the best next step? The answer is nucleic acid amplification test, or you can say PCR. Why? Because if negative, it excludes the Neisseria, gonorrhea. The For chlamydia, the gram stain is negative because the chlamydia is intracellular. The chlamydia is intracellular, so it does not take the stain because there is boundary for it. There is boundary for it. So if they ask why it is not identified on the gram staining, the answer is because it is intracellular. So the best test for it is nucleic acid amplification test or PCR. And what is the best treatment? The best treatment is azithromycin. If that is not in the option, then choose the doxycycline. Choose the doxycycline. Well, there is another MCQ. A patient is having PID. You give ceftriaxone for 5 days, no response. What is the reason? The reason is usually PID having both diseases simultaneously, gonorrhea plus chlamydia. And the ceftriaxone does not cover chlamydia. For chlamydia, you have to use azithro or doxycycline. So 3 to 4 MCQs are covered in this. Overhead option C is the right. Person after injury talk without sense. Now, whenever there is no sense, it means there is no comprehension. If there is no comprehension, it means this is Wernicke's. But if there is comprehension, and the person cannot deliver the message, then this is Broca's aphasia. Blood supply. Which artery is damaged if a person is having Broca's? Interior branches of MCA. And which branches are damaged if a person is having Wernicke's? The answer is posterior branches of MCA. Coming next, most common cause of a UTI. This is actually E. coli, but if asked in a sexually active woman, that is Staphylococcus saprophyticus. So there is a famous MCQ. A woman from honeymoon comes to you. So she's recently married and she came to you after honeymoon and she's having UTI. What is the cause? Staphylococcus saprophyticus. Breast lymphatic drainage internally, it drains into the internal mammary artery. It is also called internal mammary lymph nodes. It is also called parasternal lymph nodes. From the lateral group, it goes into the apical group of lymph nodes. Epithelium of the ovary is the simple cuboidal. Coming next, a surgeon is doing a research on tissues after laceration, injury to the tissue. So if there is injury to the tissue, what is the first response? Vasoconstriction. This is the first response you see after the tissue injury. That is vasoconstriction. Coming next, blood buffer system is mainly composed of bicarbonate. Right answer. Coming next, cervical mild dysplasia. CIN1, this is mild, 2 is moderate, 3 is severe. So here it is mild. Left shift of oxygen dissociation karo. Now the increase in all of the thing causes right shift except low pH. pH is down, right shift. All the things like temperature, right shift. Increase in CO2, right shift. Increase in the DPG, right shift. But if we are decreasing all these things, then it will cause left shift. And increase in pH would cause left shift. So over here, hypothermia is the right answer. Carboxyhemoglobin would cause right shift or left shift. Carboxyhemoglobin means carbon monoxide is attached to the hemoglobin. So if carbon dioxide is attached to the hemoglobin, it would not allow the oxygen to bind. So there is decrease. If carbon monoxide is attached to the hemoglobin, it increases the affinity for oxygen to the hemoglobin. This is actually the thing. If carbon monoxide is attached to the hemoglobin, the affinity of oxygen for hemoglobin is increased and there is a tight bonding. If there is a tight bonding, it causes the left shift. It causes the left shift. Left shift means there is a tight bonding between the hemoglobin and oxygen, and there is increased affinity, and there is decreased release of oxygen to the tissues. There is decreased release of oxygen to the tissues. So it causes anemic hypoxia. It causes anemic hypoxia because the hemoglobin cannot deliver oxygen to the tissues. What causes methymoglobinemia? The methymoglobinemia, the problem is, if this is the RBC and this is hemoglobin, the problem is the hemoglobin, the oxygen cannot bind with the hemoglobin because it changes the distribution of the hemoglobin. Actually, the iron in the hemoglobin, that is changed. The valency of the iron is changed. If the valency of the iron is changed, it cannot bind with oxygen. If it cannot bind with oxygen, what does it mean? If it cannot bind with oxygen, what does it mean? It means there is decreased affinity, there is decreased bonding. So it means it would cause the right shift. It would cause the right shift. It would cause the right shift. So coming next, a patient's sister died of a breast cancer 15 years ago. She's taking HRT for 10 and has a history of ischemic heart disease, and she's at risk of developing. Now over here, if you see, for breast cancer in this scenario, you are having point number 1, history, family history. Point number 2, next thing is she's using HRT. So two culprit. The answer is C, a breast. The answer is C, a breast. Coming next, fetal hemoglobin 3rd month. Next is a node ion channel for depolarization calcium and sodium. That is called the funny current. After hysterectomy, patient is facing problem with distended abdomen which artery is involved. So that is close to the ureter. That is uterine artery. Germinal centers are present in, that is actually the cortex of nodes. And the cortex has mainly the germinal centers. Well, they are talking about the lymph nodes. And the answer is cortex. Clearing of a drug is dependent on plasma half-life, and the plasma half-life is dependent on volume of distribution. Volume of distribution. Which of the following structure pierced while giving epidural drug? That is ligamentum flavum. You go through ligamentum flavum. You are having the first, you go through the skin. The first layer is skin, then the subcutaneous tissues, then supraspinous ligament. This is actually the supraspinous ligament. Then the interspinous ligament, and then you are having ligamentum flavum, and then after the ligamentum flavum you are having the epidural space. Then you are having the dura mater, then the subdural space. This is subdural space. Then you are having arachnoid mater, then this is subarachnoid space. So you go through like this and you cover all the thing. This is the spine, the midline approach. There are two MCQ on this. One is the paraspinal approach, that is from the side you go. If you are going from the side, you are actually sparing these two ligaments, and this is the main concept, the interspinous and the supraspinous, and you go through ligamentum flavum directly. So the ligamentum flavum is in both the paraspinal and the midline. In the paraspinal, which structure is damaged? That is, or pierced, that is ligamentum flavum. In the spinal approach, you are having all these three layers. And the first resistance, this is another MCQ. You are passing the needle, you feel resistance. That first resistance is felt when you are passing through. The answer is ligamentum flavum. This is the first resistance. The second resistance you feel in the needle is dura mater. This is the main thing, dura mater. Dura mater. There is another MCQ. You are passing the needle, the syringe into the subarachnoid space uh, for injection of the local anesthetic in the subarachnoid space, and there is a blood coming in the syringe. What is the source of this blood? The answer is epidural venous flexes. Epidural venous flexes. That is the source of bleeding. And traumatic lumbar puncture. Coming next. Diabetic patient with constructed pupil and ptosis. This is important thing. Only ptosis. If a patient is having only ptosis, the answer is myasthenia gravis. If a person is having ptosis with constructed pupil, the answer is Horner syndrome. Horner syndrome. If a person is having ptosis with dilated pupil, the answer is third neuropalsy. Third neuropalsy. Coming next, answer over here is Horner syndrome because the pupil is constructed. A researcher wants to study drug effect on different disease people. He randomly classifies disease person into two groups and drugs are given to the study effect. Type of sampling is stratified random sampling. True hermaphrodite genotype is already discussed in the detail. Double XY, so it is actually the XX. If it is not in the option, then XX is into XY. If that is not in the option, then double XY. One of the following crosses placenta, that is IgG, and among the subtypes, IgG are having four subtypes: IgG 1, 2, 3, and 4. It is IgG 1 that is important regarding the immune response. Coming next, a female patient has gone through lumbar pain and anuria after 24 hours of abdominal surgery. Which of the following structure is involved? That is ureter. Urinary retention. Ureter. Patient came with the fever and has been taking medicine which causes corneal opacity. So for the corneal opacity, you are having the chloroquine. For the retinal opacity, you are having the phenothiazine. For retina, phenothiazine. For the lens opacity, chlorpromazine. But over here a patient is having fever, so it is chloroquine, because the chlorpromazine and phenothiazine are not used in case of fever. 30 weeks pregnant female has shortness of breath. Now focus on this scenario. Amniotic fluid embolism occurs when there is a rupture of membrane and there is sucking of the amniotic fluid or amniotic cell that causes embolism, and there is DIC. Focus on this for amniotic fluid embolism. There is a picture of DIC. You are having decreased platelet, you are having increased APTT, and you are having increased FDPs, and you are having decreased fibrinogen, Over here, there is another MCQ that is coming into my mind. How do you diagnose? What is the single most important diagnostic test for DIC? That is FDPs, fibrin degradation products. The next MCQ is, how do you measure the severity of DIC? The answer is serum fibrinogen. If that is low, it means the liver cannot produce it more and the destruction is much high. So decrease in fibrinogen is for severity and increase in FDP is for diagnosis. Over here, there is nothing mentioned about the rupture of membrane and nothing mentioned about the DIC, so I would not pick this option. Why not fat embolism? There is no history of fracture of long bones like femur, humerus, no fracture of the pelvic bones. These two are the most common. And also there is neurological manifestation. person is confused, and a person is having petechiae, and the person is having low platelets. This is very important. Low platelets, but workup per DIC is negative, and the person is having eosinophils in urine. Eosinophils in urine. This is fat embolism. This is fat embolism. Well, another thing is that these two kills the person instantaneously, very quickly, within 24 to 48 hours. Although the cases may extend beyond 2 days or 3 days, but for examination point of view, they would kill the person quickly. Pulmonary embolism, it can take times. So, is there a poor recall of these MCQs? Most of these MCQs are of poor recall. So we have to just clear our mind to not to pick the wrong option during exam. That is the key. That is the key that I am discussing these MCQ. They can change the scenario a little bit. They can change the scenario a little bit. So here pulmonary embolism is the right answer. Chromosomal aligned equatorial plate in metaphase. A female had severe injury after RTAs 2 to 4. It caused the rectal incontinence, urinary incontinence, both. Answer is A. Membranous urethra in female lies over the pelvic fascia or the urogenital diaphragm. Both are the right answer. This is one option. Next, a known case of hereditary spherocytosis came to physician with a rate count of 10%. Paleness hemoglobin. Now, how do you differentiate between aplastic crisis versus hemolytic crisis? They are checking your this knowledge. In aplastic crisis, your retic count is low. Normal retic count is 0.5 to 1.5%. So your retic count is very low, less than 0.5% or 1%, you can say 2%, you can say 3%, you can say. And the hemolytic crisis, the retic count is high. The retic count is high. The retic count is high. So that is the basic differentiation point between these two, on which you can differentiate it. The aplastic crisis and hemolytic crisis. Well, both of these are seen in the sickle cell disease and the hereditary spherocytosis. For aplastic crisis, the most common cause is parvovirus B19. Parvovirus B19. Parvovirus B19. So there is in aplastic there is decreased production of HB. In hemolytic there is increased destruction of RBC or HB. So what happens in aplastic? The bilirubin is not that much raised. In hemolytic there is increase in the unconjugated bilirubin. But the main thing you can differentiate between the two on the retic count. Coming next. So answer over here is hemolytic crisis is the right answer. A female of 43 years old come to the gynecologist with cervical dysplasia. Most common cause is human papilloma virus. Right answer. Drug causing thrombocytopenia is thiazide. Right answer. Heart muscle do not exist due to the long refractory period. Long refractory period. Which of the following is mucinous gland? The answer is sublingual gland. Which is serous parotid. Which is both serous and mucinous submandibular. That is submandibular. That is both serosanguinous. This is called serosanguinous. That is called serosanguinous. Coming next. A person got stitches on the wound, but oozing from the wound still present. It could be foreign body. Source of infection. Child aspirates peanut while he was playing. It will go into right main bronchus. Right main bronchus. If there is not an option, then it will go to the right lower lobe. Which segment of the right lower lobe? Superior segment of the right lower lobe. Superior segment of the right lower lobe. If that is not, then posterior segment of the right lower lobe. So that is the right answer, because the person was standing. If the person is lying, If the person is lying, let's suppose this is the right lung, this is the right lung. So we are having the upper lobe, middle lobe and lower lobe. Into which lung the foreign body goes most commonly? The answer is right lobe, right lung. Into which lobe it will go? Right lower. But if they are saying into which segment of the right lower lobe, that is the superior segment. Now how would you remember this? You would make a lung in the standing position. This is photographic representation, and you cannot forget photographs easily, they last longer. So it has got superior segment and a lot of other segments. So you focus on this. If this is standing position, so it goes to the superior segment of the right lower lobe. In the lying position, it would go into the posterior segment of right upper lobe. In the supine position, posterior segment of right upper lobe. In the right sided lying position, it would go into the right middle lobe. So if the person is standing, it would go to the right lower lobe. If the person is supine, right upper lobe. And if the person is lying on the right side in bed, right middle lobe, right middle lobe. But if the person is lying on the left side, where it would go? The left inferior lingular lobe, the left inferior lingular lobe or segment, lingular lobe or segment. Coming next, a female has a problem of concentrated urine. No, this is actually the MCQ. Kidney secretes hyperosmotic urine, decrease water content in now the kidney secretes the hyperosmotic, it means the osmolarity of urine is high. So in which disease the osmolarity of urine is high? That is SIADH. It absorbs almost all of the water and the osmolarity of urine is very high. So in decreased water content in, where would you see decreased water content? So if this is your nephron, where the ADH acts on, the ADH acts on this collecting and collecting duct. So it will be in distal DCT. So the answer over here would be medullary collecting duct, because all of the water is absorbed. So maximum osmolarity would be here, and there will be decreased water content. So this is medullary collecting duct. If that is not in the option, then I would pick the cortical collecting duct. If that is not in the option, then I would pick distal DCT, because more water is going to be absorbed and there is hyperosmotic urine. If there is hypoosmotic urine, what does that mean? Osmolarity of urine is low, and that is which disease? Diabetes insipidus. And diabetes insipidus, we are having two problems, either central or peripheral. So they can ask about the peripheral. So which portion is having problem in diabetes insipidus? The answer is ADH cannot act on this thing. ADH cannot act on and cannot absorb water. If they are asking about decreased water content, so if ADH cannot absorb water from here, so what do you think? There will be decreased water or increased water, because the water is not going to be absorbed. If the water is not going to be absorbed, what happens? There is increased water content. So where will be decreased water content? Over here, again increased water content, because ADH cannot act on it. Again over here there will be what? There will be increased water content, and here this is diluting segment. It dilutes urine, again it will be diluted. So this is the tip of the loop of Henle. Over here you are having concentrated urine. Over here you are having concentrated urine. So if it is passing over here, the solutes moves out and it become diluted. So if the question says more water content, the answer is this one. Less water content, or this one. This is in case of hypoosmotic urine. This is in a case of hypoosmotic urine. So I think I have made this thing clear. If the word is hypoosmotic, then the tip of the loop of Henle. If the word is hyperosmotic, look for medullary collecting duct. If that is not cortical collecting duct, if that is not distal convoluted tubule. Over here they have given you DCT and collecting ducts together, so that is the right answer. Coming next, which of the following organelle transmitted from mother? That is mitochondrial DNA transmitted from mother, that is from ova. Next, a person, because if this is the sperm, it sends only its genome, the rest of the DNA and the thing lies outside.